A burn patient is one of the sickest patients you can have, and the most challenging patient you can have from a clinical aspect. I'm the director of the Ross Tilly Burn Center at Sunnybrook, which is the largest burn center in Canada. Burn has been a neglected injury worldwide. We have over 300,000 people dying from burns annually. There are over 300 million people getting injured with a burn injury worldwide. So it's a very large number. We now are able to get patients to survive the first 2, 3, 4 weeks. However, due to metabolic alterations called the hypermetabolic response affecting every organ system, your brain, your heart, your liver, your kidney, everything, and the subsequent immunology, subsequent skin alterations, patients then become infected, septic, and deceased due to the injury. Our endeavor is to seek skin replacement, that you do not have to take the patient's own graft. What we currently do, you take a dermatome, take the skin and put it on the patient's other side. So if you have a 30% burn, so all of a sudden you have a 60% of your body surface area wound, which is to me barbaric. We are working with collaborators on developing a skin printing machine where we take a matrix, put autologous stem cells or autologous cells into this matrix. Autologous meaning it is from your own body, and print the patient's own new skin with 6 centimeters per hour. So in a couple of hours we can have a patient completely printed. It is really it seems visionary, right? It seems like a futuristic movie where you say, I put cells in the one end, have a thing coming out here, and at the end we have functional skin. So my hope is that we make these strides in terms of the hypermetabolic response, that we can attenuate this detrimental and profound alterations in your body, and that patients do not lose 30, 40 kilograms of their body weight, that they can heal their wounds. That we even go further, that we actually tissue engineer. If you have an amputation due to electrical burn, we create muscle and fat or bone, and basically they are on tissue engineering basis help these patients. Our laboratory is very much translationally oriented. It is very much an open forum. Everybody speaks, everybody presents, everybody can present ideas and visions. We have a setup now with Sunnybrook and the Sunnybrook Research Institute that the students can join on rounds, as I said, can come to critical care rounds, or they can join me in the OR. Let's say we have the question of inflammation immune system in a certain patient population. Let's say all patients that are burned over 40%. So then we can activate our clinical research side, and the student can go to himself, need the data, the student gets the data, then we have a tissue bank from these patients, and then we have access, we can study this, and then the student says, I want to see these patients. We go to clinic, or we go to the ICU or to the OR, and he can see what we do. So there's, again, this is this unique link between lab and clinic where you have a direct impact on patient's life. It is important that when I stand at the bedside of a patient, that questions arises, that I can say we studied this in the laboratory, and that this patient is surviving because we discovered something in the lab that can impact his outcome. To me, that is translational medicine. I initially worked with severely burned children for the majority of my life. There's nothing more humbling and inspirational than these children that survive big burns and become normal. It's remarkable how these children develop into good human beings, integrated happiness, and they don't see themselves as different. And so to me, that is absolutely inspirational. To me, that's all I need in order to have my passion and my drive and my engine and inspiration.